Scientific research and innovation are essential ingredients for the future of healthcare. It all begins with the researcher, the scientist, imagining a better way to treat the disease. Just look at all of the life-saving drugs in our pharmacies and in our homes, at the new procedures that effectively treat disease in ways that years ago could only be imagined. At the Feinstein Institute, we study how disease occurs to develop new medicines, new medical devices, and new therapies, and eventually used in hospitals and clinics worldwide.
We are in a unique position at the Feinstein Institute, using our strength in medicinal chemistry to collaborate with the scientists. It enables us to develop novel therapeutics.
Pulmonary hypertension is essentially caused by inflammation in the lungs. The blood is not able to easily flow through the lungs, and so there's an increase in pressure.
As a result, the right heart has to work harder and over a period of time begins to fail. And untreated, this condition is fatal within 5 to 6 years.
So at the Feinstein Institute, we have identified the first molecule that will reduce this inflammation.
This collaboration has resulted in a large NIH trial to see this molecule develop to the point where it is available as a treatment.
This is an extremely difficult disease to live with because it becomes so overwhelming sometimes. So it would be wonderful if they came out with a new medication.
The results from these studies will be very relevant not only to pulmonary hypertension but to other disease states where inflammation is increased, including stroke, cardiovascular disease, and sleep apnea.
Our preliminary data shows evidence that early intervention in complications of pregnancy may lead to a healthier outcome in childhood all the way up into old age.
Pregnancy is a delicate balance for the mother and the unborn child.
Unfortunately, there are challenges that occur in some pregnancies like preeclampsia or diabetes, exposure to medications. These are some of the challenges that we work on between the Feinstein Institute and North Shore LIJ Health System.
This program allows scientists like myself to gain better understanding of the patient's unmet needs. And it allows physicians to gain valuable research expertise.
It has been so important to come to the Feinstein Institute to research basic science and later can be translated into treatments that in the future may help my patients.
In fact, there is some evidence that early interventions can even reduce the risk of disease over generations.
Knowing that the doctors and scientists are compiling research to help unborn children reach their full potential makes us feel so great and gives us hope for the future for our child and for our children's children.
This is a very exciting time to take advantage of some emerging technologies to help patients and families manage schizophrenia in the most effective way. Schizophrenia is a chronic brain disorder that affects 2.2 million people in the United States alone.
Some of the most important factors in helping people with schizophrenia is to prevent relapse and rehospitalization, as well as providing tools to help them learn how best to cope with their illness.
So what we've developed is the ability to use smartphones with a variety of applications, giving them some strategies to help manage their symptoms.
We also have a web-based psychoeducation tool designed to provide immediate support and education to the patient and to their families.
They can even participate in a chat group or a therapy group with other patients with the involvement of a therapist.
So having that community and having that sense of structure in my life made it possible to, move forward.
These new technologies better equip our patients when they're directly outside of our care. And it's really exciting to see how it can help improve the quality of their life.
We understand now that genes are one of the risk factors for many diseases.
The most direct way to get at the function of these genes is to study them in normal people who don't have a disease. We've established a unique registry here at the Feinstein Institute called the GAP Registry, which currently has about 4,000 healthy volunteers.
I heard about the GAP research project at the Feinstein, and I thought it was important to donate my blood so the scientists had a healthy blood sample to analyze as a means to develop better treatments.
So the GAP program is ongoing. This allows a citizen of the local population to actually contribute directly to genetic discoveries and understanding the causes and possible cures of Parkinson's disease, Alzheimer's disease, cardiovascular disease, and autoimmune disorders.
The Feinstein is a core essential part of the success of the health system. Not every healthcare organization has research components, and very few have the talent that exists at a place like the Feinstein.
Collaboration is at the heart of the Feinstein approach to science.
The openness and transparency and the free exchange of information is something that gives the Feinstein Institute a substantial advantage in being more efficient and more creative.
We have an appropriate atmosphere so that we can get the benefits back to the patient.
We can test our ideas in the clinic with the availability of a facilitating health system and patients in need.
People from the research team definitely take care of their patients, definitely understand their patients. They're authentic people.
Understanding that scientists and doctors are collaborating together is a wonderful idea.
The earlier they detect things, the sooner you can get those new, better treatments. Without that research, we just don't know.
The pace of scientific advance and discovery here at the Feinstein is inspiring. The impact that we are having now will be measured in the future by the lives that are improved, by the diseases that are eradicated, and by the improvements that society will experience. The science is the key to the future, and the future looks extremely bright.